Thank you. In the North American region, HIV continues to be concentrated among key populations, but it's worrisome to see that infections among women and girls are rapidly rising. Other notable groups with rising infection rates include Aboriginal and Indigenous peoples, a population rarely mentioned on the floor of the PCD in my experience, racialized communities, immigrant communities, prisoners, transgendered people, and youth, in addition to the more well-recognized risk groups of gay men, drug users, and sex workers. These, of course, are overlapping epidemics, impacted greatly by factors such as poverty, homelessness, stigma and discrimination, and many other factors. Key issues of concern for civil society in North America include, as in other regions, harm reduction, hepatitis co-infection, and human papillomavirus co-infection leading to heightened rates of cervical cancer in women, and a new emerging condition of anal cancer in men and women. As people live longer, an emerging issue of concern is aging with HIV and how people live and cope with drug side effects and multiple comorbidities, including premature neurocognitive impairments. Although the situation regarding HIV travel restrictions has greatly improved in our region, a significant issue remains criminalization of HIV transmission. Increasingly, criminal charges are being laid in cases of non-disclosure of HIV status, even when there is no evidence of transmission. This is an issue of great concern, and as we know, it clearly undermines an effective public health approach and our attempt to scale up prevention, treatment, care, and support. Finally, we want to point out that there's a growing and very disturbing tension in our region between the domestic and international AIDS responses. In the face of economic uncertainty and funding cutbacks, people are increasingly focused on domestic priorities to the exclusion of both international AIDS work and international development. One increasingly hears among the general public, government, and even our civil society colleagues, why should we care about what happens overseas when we have our own AIDS crisis here? Our job is to work aggressively with civil society to convince them that AIDS is a global issue and that both domestic and international AIDS responses are crucial. Our job is also to pressure government to ensure that adequate funding is in place to respond domestically, and that as donor countries, they honor their funding commitments to UNAIDS, the Global Fund, and international development. Thank you.